personally looking forward to seeing. It's in private beta now with a medical system in the Carolinas. It was developed by physicians out of North Country Hospital who came to one of our TechAt networking events in Scrubs. And very independently, they've gone off and are really trying to solve the problem of medicine. Big thing to try and tackle.
Yeah.
And really, I just love how it was formed around the concept that people will be healthier if they get the right tools and the right information in the right form. So again, mobile, social, relevant medical information in a consumer-friendly format. And it's called Peachy. It's being tested, and I hope it's soon to deploy here in this year. And I think, too, Vermont in particular, given the expertise around medical software this year with certainly IDX and GE Health and a number of other companies, we're really poised. We've got the right talent, the right people to develop mobile applications further in the health sector. And I think, too, there's a lot of speculation that 2013 was going to be the year that actually doctors would begin prescribing to their patients, download this app, right? Which I find my mind just starts to spin. But I think that's where we're headed.
Well, how do you see that working in a place like Vermont where, even though in a lot of places it can be difficult to find access to health care, compared to other parts of the world, we still have it pretty good. In a place like Vermont, where do you see the future of healthcare apps going?
I think it'll just become more and more embedded. You'll start with the light layer. It'll be around patient activity tracking, telemed tests, which is a UVM licensee company, rather than a notebook that tracks. You'll have an app that does that, and you'll have an electronic medical logbook. So that's one example. And through little small peripheral add-ons that, where the headphone jack is right now, that's really a power cord for another small device. You may be familiar with Square, like a payment, right? You can take a credit card reader, but, well, guess what? You also can put readers on that will measure glucose levels or some other data. It's a big Wild West sort of world right now, but I do think in Vermont we have entrepreneurs that have the right skills, the right motivations. So I personally think that's a big opportunity for investors and for entrepreneurs.
David Bradbury is